Suicide, a community nursing teaching project by Mark Allen Stearns. There is no one single cause for suicide. Many different factors may contribute to suicide. For example, substance abuse and untreated depression. Now I'm going to talk about 5 warning signs to suicide. First one is talking about wanting to die. Some people may talk about how they don't want to live anymore. They start to ask the question, what do you think it would be like if I wasn't around anymore? They usually think these things in their head and start to have thoughts of dying. The thoughts start first and then it progresses. They want to die because they feel as though they are a burden to others. They may research ways to kill themselves or even buy a gun or a knife. They also will dwell on the topic of dying. They'll actually do research on dying. The second one is they may feel worthless. This is where they will say things like, who cares? No one really cares about me anyway. They may make this statement, I can't seem to do anything right. Everything I do is wrong. I'm no good to anyone. I'm stupid and I can't do it. They may also feel empty, and they may also feel as though there is no way out of their current situation that they are in. And the third warning sign is they may sleep too much or they may sleep too little. For example, some people have a hard time just getting out of bed in the morning, and it's a real struggle. They are usually battling with themselves. Their mind wants to do one thing, but their body is saying something else. We can see these signs in some people. For example, they may be late to work or lacking concentration at work. Easy tasks may now be difficult because they are having trouble focusing. Sleep can be a big indicator, too little or too much. This also can affect a person's mood. They may become anxious. They may become sad or angry. They may also become irritable, moody, and aggressive. The fourth thing I want to talk about is they tend to give away personal items. This is a huge red flag. Some people will actually start to give away their personal items, such as electronics, money, or anything that they value the most. They may also try to wrap up loose ends. And lastly, they have a feeling of withdrawing or feeling isolated. Some people will actually start to withdraw and don't want anything to do with anyone. They may say things such as, I want to be alone. They really don't want to talk to anyone at home or work. If this happens, we need to ask them the question, are they okay? How are they doing? Do you need somebody to talk to? Here are 5 steps that you can use to help someone that is in emotional pain. The first one is to ask. Ask the person directly, are you think are you thinking of killing yourself? By simply asking someone this does not increase their risk of committing suicide. Studies have shown that we need to ask the awkward and difficult questions. Number 2, keep them safe. We need to reduce the person's access to lethal weapons. We also may need to ask the question, do you have a plan? Removing items such as a gun or other lethal items will help that individual stay safe. Thirdly, you want to be there. This is important. We need to listen to those people in need. We need to really hear what they are saying. We need to acknowledge what they are saying and talk to them about their feelings that they are having. We need to pay attention to what people say because we could miss some important information. We need to ask them, how are they doing? And we need to be prepared for the answer. It may not be what we expect it to be. We also need to help them connect. You want to put the suicide number in your phone so it's readily available when you need it. You can also help them get connected with trusted family members, spiritual advisors, or even mental health professionals. The Suicide Prevention Lifeline is 1-800-273-TALK. That's again 1-800-273-TALK. That's 8255. So that number again is 1-800-273-8255. And the crisis text line is 741-741. And finally, we want to help them stay connected. You want to make sure that you are staying engaged with this person. There are studies that show a decrease in suicide when someone shows that they care. We need to follow up and ask the question, how are you doing today? How are you feeling? We need to show these people that we care. Now, in talking about suicide, we want to talk about the resources that are available, treatments, and some of the therapies that are available. Now, I want to mention that if you suspect someone needs help and is showing signs of suicide, you need to get them help. The National Suicide Prevention Lifeline is 1-800-273-8255. And I also want to mention here that hospitals today are now doing a preventative measure in which they are doing screenings and assessing people that come in for just a basic appointment. Now I want to talk about some of the treatments and some of the therapies. You want to develop a personalized safety plan. You want to work with a caregiver to develop a plan to limit the access to lethal means such as firearms, pills, something like that. You also want to give them someone that they can call in a time of need or in a time of crisis. Now, you also have cognitive behavioral therapy. This basically helps individuals recognize their own thought patterns and consider alternative actions. And what I mean is they want to consider other ways of dealing with certain situations, how to deal with a crisis, or if something's not going your way, teaching them how to deal with it, how to look at it a different way. Then we also have dialectal behavioral therapy, in which we have a trained therapist which helps a person recognize his or her own feelings or actions that are disruptive and unhealthy, they teach them certain skills that they will need to deal with these situations. Now, there's other types of things such as collaborative care, the use of a behavioral health care manager, a primary care doctor, and a mental health specialist. They all work for one common goal. They all develop a treatment plan that best and the best ways to implement that plan for that specific person. Now, also another type of treatment or therapies is medication. This is where the doctor work alongside a patient to find the best medication or combination of medications that will help. And one thing to note that if you are prescribed a medication, do not stop taking it without a doctor's order because it has the potential to worsen symptoms.